Question 1. Infection control and safety. A patient care technician is assisting with a wound dressing change for a patient with an open pressure ulcer. The technician removes the old dressing with gloves on, discards it properly, and immediately puts on a new pair of gloves before applying a fresh dressing. Which of the following infection control protocols did the technician fail to follow? A. The technician should have used sterile gloves instead of clean gloves for the procedure. B. The technician should have performed hand hygiene before putting on the new gloves. C. The technician should have changed the dressing using a non-touch technique. D. The technician should have double gloved during the entire procedure. Answer: B. The technician should have performed hand hygiene before putting on the new gloves. Explanation: the Centers for Disease Control and Prevention (CDC) and Occupational Safety and Health Administration (OSHA) guidelines require healthcare workers to practice proper hand hygiene before donning a new pair of gloves. Changing gloves alone is insufficient because microorganisms can still be present on the hands and contaminate the new gloves. To wash hands between glove changes increases the risk of cross-contamination, especially when dealing with open wounds. A. Incorrect. While sterile gloves may be necessary in some wound care procedures, clean gloves are acceptable for most dressing changes unless a sterile field is required. C. Incorrect. A non-touch technique is preferred to minimize contamination, but failure to use it is not the most critical infection control breach in this scenario. D. Incorrect. Double gloving is generally used for high-risk procedures, e.g. surgery, but is not for routine wound care. Question 2. Electrocardiography, ECG monitoring. A patient care technician is performing an ECG on a patient who has been experiencing dizziness and shortness of breath. After placing the electrodes, the technician notices excessive artifact on the ECG tracing. What should the technician do to troubleshoot this issue? A. Ask the patient to remain still and ensure the electrodes are securely attached. B. Switch the limb leads with chest leads to see if the tracing improves. C. Increase the ECG machine sensitivity to amplify the heart's electrical signals. D. Proceed with the tracing as is, since minor artifacts do not affect diagnosis. Answer: A. Ask the patient to remain still and ensure the electrodes are securely attached. Explanation: artifact in an ECG tracing can be caused by patient movement, poor skin preparation, or loose electrodes. According to the American Heart Association (AHA) guidelines, the best approach to reducing artifacts is to ensure the skin is clean and dry before electrode placement. Instruct the patient to remain as still as possible and check that the electrodes are firmly attached to the skin. B. Incorrect. Switching limb leads with chest leads will not resolve artifacts and will result in incorrect lead placement. C. Incorrect. Increasing the machine sensitivity amplifies all signals, including unwanted artifacts, making interpretation more difficult. D. Incorrect. Even minor artifacts can obscure important cardiac rhythms and lead to misinterpretation, so they must be addressed before proceeding. Question 3. Scenario-based. Law, ethics, and patient rights. Mr. Rodriguez, 67-year-old patient, has been receiving dialysis for chronic kidney disease. He recently expressed that he no longer wishes to continue treatment and wants to be discharged despite the physician's recommendation to continue dialysis. As patient care technician, what is the appropriate action in this situation? A. Inform Mr. Rodriguez that discontinuing treatment is not an option and notify security if he insists on leaving. B. Encourage Mr. Rodriguez to reconsider his decision and document his refusal to continue treatment. C. Respect Mr. Rodriguez's decision, notify the nurse, and ensure that the patient signs an against medical advice form. D. Proceed with the dialysis session as scheduled because the physician has determined it medically necessary. Answer: C. Respect Mr. Rodriguez's decision, notify the nurse, and ensure that the patient signs an against medical advice form. Explanation: patients have the legal right to refuse medical treatment under the Patient Bill of Rights and the principle of informed consent. The Health Insurance Portability and Accountability Act, HIPAA, and ethical guidelines require healthcare providers to respect patient autonomy even if their decision may result in negative health outcomes. A. Incorrect. Forcing treatment or involving security for competent patient refusing care violates patient rights. B. Incorrect. While discussing the decision with the patient is acceptable, it is not sufficient. Proper legal documentation, form, and nurse notification are necessary. D. Incorrect. Treatment cannot be forced upon patient who has decisional capacity and refuses care. Question 4. Basic patient care. Skin integrity and pressure ulcer prevention. 78-year-old patient with limited mobility has been admitted to long-term care facility. The patient is at high risk for developing pressure ulcers due to prolonged periods of bed rest. As patient care technician, what steps should be taken to minimize the patient's risk of pressure ulcer development? A. Reposition the patient at least every 2 hours and use pressure-relieving devices such as foam cushions. B. Massage reddened areas to stimulate circulation and prevent the formation of ulcers. C. Limit fluid intake to prevent excessive moisture on the skin, which could contribute to skin breakdown. D. Apply talcum powder and tight-fitting bandages over bony prominences to reduce friction. Answer: A. Reposition the patient at least every 2 hours and use pressure-relieving devices such as foam cushions. Explanation: the National Pressure Injury Advisory Panel (NPIAP) recommends repositioning immobile patients at least every 2 hours to prevent prolonged pressure on bony prominences such as the sacrum, heels, and elbows. Additionally, using pressure-relieving devices such as specialized mattresses, cushions, and heel protectors can reduce the risk of skin breakdown. B. Incorrect. Massaging reddened areas can cause further damage to already compromised tissue, increasing the risk of ulcer formation. C. Incorrect. Hydration is essential for maintaining skin integrity. Restricting fluids can lead to dry, fragile skin, which is more prone to breakdown. D. Incorrect. Talcum powder can cause skin dryness and irritation, and tight bandages increase pressure rather than relieve it. Question 5. Infection control, bloodborne pathogens, and OSHA compliance. Patient care technician is assisting with blood collection in hospital setting. After performing successful venipuncture, the technician accidentally sticks themselves with the used needle while attempting to dispose of it. According to OSHA's bloodborne pathogens standard, what is the technician's immediate priority? A. Finish the procedure with the patient and then wash the site with soap and water before reporting the incident. B. Immediately wash the puncture site with soap and water, report the incident to the supervisor, and seek post-exposure evaluation. C. Apply an alcohol swab to the puncture site and continue working unless symptoms develop. D. Squeeze the wound to remove potential contaminants and then bandage the area without reporting the incident. Answer: B. Immediately wash the puncture site with soap and water, report the incident to the supervisor, and seek post-exposure evaluation. Explanation: the Occupational Safety and Health Administration (OSHA) requires healthcare workers to follow post-exposure protocols when a needle stick injury occurs. The proper steps include washing the affected area immediately with soap and water. Do not squeeze the wound, reporting the exposure to the designated supervisor or occupational health department. Undergoing post-exposure evaluation and possible treatment, including testing for bloodborne pathogens such as hepatitis B, hepatitis C, and HIV. A. Incorrect. Delaying hand washing increases the risk of infection exposure. C. Incorrect. An alcohol swab is not a sufficient decontamination measure, and symptoms may not appear immediately. D. Incorrect. Squeezing the wound can force pathogens deeper into the tissue, increasing the risk of infection. Question 6. Phlebotomy and specimen collection. Venipuncture techniques. Patient care technician is drawing blood from patient using the antecubital vein. The patient suddenly becomes pale, dizzy, and unresponsive. What is the best immediate action the technician should take? A. Remove the needle immediately. Place the patient in supine position and elevate their legs. B. Continue the procedure quickly before the patient regains consciousness to complete the blood draw. C. Shake the patient gently to wake them up and ask if they want to continue the procedure. D. Call for emergency assistance but leave the needle in place until help arrives. Answer: A. Remove the needle immediately. Place the patient in a supine position and elevate their legs. Explanation: a patient experiencing dizziness, pallor, and unresponsiveness during a blood draw is likely experiencing vasovagal syncope fainting. The proper steps to take include immediately removing the needle to prevent injury, placing the patient in a supine position and elevating their legs to improve circulation, monitoring the patient, seeking medical assistance if they do not regain consciousness promptly. B. Incorrect. Continuing the procedure while the patient is unconscious increases the risk of injury and is unsafe. C. Incorrect. Shaking an unconscious patient does not address the underlying circulatory issue causing the fainting episode. D. Incorrect. Leaving the needle in place while calling for help risks injury and should be avoided. Question 7. Emergency procedures. CPR and basic life support. BLS. Patient collapses in the hallway of healthcare facility and patient care technician finds them unresponsive with no signs of breathing or pulse. The technician is alone. What is the proper sequence of actions according to American Heart Association (AHA)? Basic life support. BLS. Guidelines. A. Begin chest compressions immediately and call for help after 5 cycles. B. Call for emergency assistance. Begin chest compressions at rate of at least 100-120 per minute and provide rescue breaths at ratio of 30 to. C. Check for breathing for at least 60 seconds before starting CPR. D. Place the patient in the recovery position and wait for emergency responders. Answer. B. Call for emergency assistance. Begin chest compressions at a rate of at least 100-120 per minute and provide rescue breaths at a ratio of 30 to. Explanation. According to OHA guidelines, the correct sequence of BLS for an unresponsive patient with no pulse is call for emergency assistance or activate the facility's emergency response system. Begin high-quality chest compressions at a depth of 2 inches, 5 centimeters at a rate of 100-120 compressions per minute. Provide rescue breaths in a ratio of 30 compressions to 2 breaths if trained in CPR. Use an automated external defibrillator ED as soon as it is available. A. Incorrect. Emergency help should be called immediately, not after multiple cycles of CPR. C. Incorrect. Checking for breathing should take no more than 10 seconds before initiating CPR if the patient is unresponsive. D. Incorrect. The recovery position is for semi-conscious patients who are breathing, not for those in cardiac arrest. Question 8. Medical terminology and documentation. Legal and ethical considerations. Patient care technician accidentally documents information in the wrong patient's chart. What is the proper way to correct this documentation error? A. Use correction fluid or erase the error completely and rewrite the correct entry. B. Draw a single line through the incorrect entry, initial and date it, and write the correct information. C. Remove the page from the chart and replace it with correct entry. D. Ignore the mistake and continue documenting in the correct chart. Answer. B. Draw a single line through the incorrect entry, initial and date it, and write the correct information. Explanation. Proper documentation practices require that errors in medical records be corrected transparently. The Health Information Portability and Accountability Act, HIPAA, and facility policies require that errors should not be erased or covered up. A single line should be drawn through the incorrect entry. The correction should be initial, dated, properly documented. A. Incorrect. Correction fluid or erasing violates legal documentation standards. C. Incorrect. Removing pages disrupts record integrity. D. Incorrect. Ignoring errors can lead to patient safety issues. Question 9. Vital signs. Blood pressure measurement and accuracy. Patient care technician is measuring patient's blood pressure using manual sphygmomanometer. The patient is seated, but their arm is positioned below heart level and they are speaking during the reading. After inflating the cuff, the technician releases the pressure too quickly, resulting in an unclear reading. What potential issues could arise from these errors, and what should the technician do to ensure an accurate measurement? A. The blood pressure reading may be falsely low. The technician should ensure the patient's arm is at heart level and retake the measurement. B. The blood pressure reading may be falsely high. The technician should have the patient continue speaking to relax them. C. The reading is unaffected by arm position or talking. The technician should record the result as obtained. D. The technician should release the cuff pressure more quickly next time to prevent patient discomfort. Answer A. The blood pressure reading may be falsely low. The technician should ensure the patient's arm is at heart level and retake the measurement. Explanation. Proper blood pressure measurement requires arm positioned at heart level. If the arm is below heart level, readings can be falsely high. If above heart level, readings can be falsely low. Minimizing patient movement and talking. Conversation during measurement can affect systolic readings. Slow deflation. Releasing cuff pressure too quickly can result in inaccurate systolic and diastolic readings. Question 10. Patient mobility. Assisting with ambulation using gait bell. Patient recovering from hip surgery needs assistance walking for the first time since the procedure. The patient care technician plans to use gait bell. What is the correct procedure for assisting the patient with ambulation? A. Place the gait belt around the patient's waist, grasp from behind, and walk slightly behind the patient for support. B. Secure the gait belt over the patient's chest, grasp the handles, and walk beside the patient. C. Place the gait belt around the waist, stand slightly to the side and behind the patient, and provide steady support while walking. D. Instruct the patient to hold onto the technician's arms while walking to provide stability. Answer C. Place the gait belt around the waist, stand slightly to the side and behind the patient, and provide steady support while walking. Explanation. A gait belt is placed around the waist to provide a stable grip for assisting ambulation. The technician should stand slightly to the side and behind the patient for stability. Hold the belt with an underhand grip to maintain control. Encourage slow, steady steps while monitoring for dizziness. All. Question 11. Infection control. Personal protective equipment (PPE). Patient in isolation for Clostridium difficile. C. Diff infection requires assistance with toileting. Which of the following PPE combinations should the patient care technician wear before entering the room? A. Gloves and surgical mask. B. Gloves and gown. C. Gloves, gown, and in mask. The NOPPE is required if the technician washes hands after care. Answer: B. Gloves and gown. Explanation: C. Diff is transmitted through spores which require contact. Precautions: gloves and a gown are required to prevent contamination. Hand washing with soap and water is essential because alcohol-based sanitizers do not kill C. diff spores. Question 12. Specimen collection. Urine sample handling. Patient care technician collects clean catch midstream urine sample for laboratory testing. What steps should be taken to ensure the sample remains uncontaminated and properly processed? A. Instruct the patient to void directly into the container without cleaning first. B. Refrigerate the sample if it cannot be tested within 1 hour of collection. C. Discard the first and last portions of urine and collect only the middle portion. D. Both B and C. Answer: D. Both B and C. Explanation: a midstream sample ensures reduced contamination from external bacteria. The first stream flushes out contaminants while the midstream portion provides a cleaner sample. Urine should be tested within an hour if delayed. Refrigeration helps preserve sample integrity. Question 13. Patient safety. Falls prevention. Patient in hospital setting is at high risk for falls due to medication side effects and impaired mobility. What preventative measures should patient care technician take? A. Keep the bed in the lowest position, provide non-slip socks, and ensure the core light is within reach. B. Raise all bed rails to prevent the patient from getting up unassisted. C. Encourage the patient to use the bathroom independently to maintain mobility. D. Keep the lights off at night to allow the patient to rest without disturbance. Answer: A. Keep the bed in the lowest position, provide non-slip socks, and ensure the core light is within reach. Explanation: keeping the bed low reduces injury risk. Non-slip socks improve traction. Core light access allows patients to request assistance. Question 14. Wound care. Dressing changes. Technician is assisting with sterile dressing change for post-operative wound. What is the correct order of steps? A. Remove all dressing with sterile gloves. Clean the wound, apply new dressing. B. Wash hands, remove all dressing with clean gloves, apply new dressing. C. Wash hands, remove all dressing with clean gloves, put on sterile gloves. Clean wound, apply sterile dressing. D. Clean the wound before removing the old dressing to reduce contamination. Answer: C. Wash hands, remove all dressing with clean gloves, put on sterile gloves. Clean wound, apply a sterile dressing. Explanation: clean gloves prevent cross-contamination while removing soiled dressing. Sterile gloves maintain asepsis during wound care. Question 15. Oxygen therapy. Safety precautions. Patient requires oxygen therapy via nasal cannula at 3 liters per minute. What is the most important safety precaution? A. Secure oxygen tubing with tape to prevent dislodgement. B. Place no smoking signs in the room. C. Apply petroleum jelly to prevent nasal dryness. D. Increase oxygen flow if the patient reports shortness of breath. Answer: B. Place no smoking signs in the room. Explanation: oxygen is highly flammable. The fire risk must be minimized. Avoid petroleum-based products as they can ignite near oxygen. Question 16. Communication. Dealing with confused patient. Dementia patient is agitated and confused. What is the best way to communicate? A. Speak loudly to get the patient's attention. B. Use short, simple sentences in calm tone. C. Argue with the patient to correct misinformation. D. Ignore the confusion and continue the task. Answer: B. Use short, simple sentences in a calm tone. Explanation: clear communication reduces agitation. Arguing worsens confusion in dementia patients. Question 17. HIPAA compliance. Patient privacy. Technician sees coworker discussing patient test results in the hospital cafeteria. What should they do? A. Ignore the conversation. B. Remind the coworker that patient information must remain confidential. C. Join the discussion but speak quietly. D. Ask for details to better understand the situation. Answer: B. Remind the coworker that patient information must remain confidential. Explanation: HIPAA requires patient privacy to be maintained. Discussing patient information in public areas violates HIPAA. Question 18. Hand hygiene. Preventing healthcare-associated infections. Hi, as patient care technician is caring for multiple patients, including one with methicillin-resistant Staphylococcus aureus (MRSA) in wound. What is the best practice for hand hygiene in this situation? A. Use hand sanitizer before and after every patient interaction. B. Wash hands with soap and water before and after patient contact. C. Wear gloves when providing care, but only wash hands if they appear dirty. D. Change gloves between patients without washing hands. Answer: B. Wash hands with soap and water before and after patient contact. Explanation: MRA is a contact transmissible infection that requires strict hand hygiene. Alcohol-based hand sanitizers are not always effective against all pathogens. Hand washing is the single most effective way to prevent healthcare-associated infections. Highs. Question 19. Pressure ulcer prevention. Proper patient positioning. Bedbound patient is at high risk for pressure ulcers. What should the patient care technician do to help prevent skin breakdown? A. Reposition the patient at least every 2 hours. B. Use donut cushion under the patient's heels. C. Apply lotion to any red areas to reduce pressure. D. Keep the patient in semi-Fowler's position at all times. Answer: A. Reposition the patient at least every 2 hours. Explanation: frequent repositioning reduces prolonged pressure on bony areas. Donut cushions increase pressure in some areas and are not recommended. Red areas indicate early skin breakdown requiring offloading, not lotion. Question 20. Emergency situations. Responding to hypoglycemia. Diabetic patient who has not eaten in several hours suddenly becomes pale, shaky, and confused. What is the best immediate action the technician should take? A. Call code blue for emergency response. B. Offer the patient orange juice or glucose tablets. C. Take the patient's blood pressure and pulse. D. Encourage the patient to lie down and rest. Answer: B. Offer the patient orange juice or glucose tablets. Explanation: pale, shaky, and confused symptoms suggest hypoglycemia, low blood sugar. A fast-acting carbohydrate juice, glucose tablets, helps quickly raise blood sugar. Delaying treatment can lead to loss of consciousness. Question 20 on ethical issues. Patient refusal of care. Competent patient refuses to take their prescribed medication. What should the patient care technician do? A. Respect the patient's decision and document the refusal. B. Inform the patient that they must take the medication as prescribed. C. Hide the medication in food or drink to ensure compliance. D. Notify the provider and request stronger approach to patient compliance. Answer: A. Respect the patient's decision and document the refusal. Explanation: patients have the right to refuse care if they are mentally competent. Hiding medication violates ethical standards. Technicians should document refusals and notify the nurse. Question 22. Assisting with feeding. Aspiration precautions. Patient with dysphagia, difficulty swallowing, requires feeding assistance. Which action is most important to prevent aspiration? A. Encourage the patient to drink fluids rapidly between bites. B. Position the patient upright at 90 degrees during meals. C. Tilt the patient's head backward to help food move down. D. Offer large bites to encourage faster swallowing. Answer: B. Position the patient upright at 90 degrees during meals. Explanation: aspiration occurs when food enters the airway instead of the stomach. Keeping the patient upright reduces aspiration risk. Small bites and slow swallowing are recommended for patients with dysphagia. Question 23. Recognizing signs of stroke. CVA. A technician notices that a patient suddenly has slurred speech and weakness on one side of the body. What is the best immediate action? A. Lay the patient flat and monitor for improvement. B. Assist the patient to the restroom in case it is dizziness related. C. Activate the emergency response team and note the time symptoms began. D. Offer water and observe for changes over the next hour. Answer: C. Activate the emergency response team and note the time symptoms began. Explanation: slurred speech and weakness on one side are signs of a stroke. CVA. Time is critical. Stroke treatments are time sensitive. Emergency response is needed immediately to prevent permanent damage. Question 24. Blood draw. Preventing hematoma formation. Technician is drawing blood from patient's antecubital vein using straight needle. What action helps prevent hematoma formation? A. Instruct the patient to bend their arm after the needle is removed. B. Apply firm pressure for at least 1-2 minutes after removing the needle. C. Use small gauge needle and keep the tourniquet on after the draw. D. Have the patient hold their breath during venipuncture. Answer: B. Apply firm pressure for at least 1-2 minutes after removing the needle. Explanation: a hematoma occurs when blood leaks into surrounding tissue. Applying firm pressure prevents bruising and bleeding. Bending the arm increases pressure and should be avoided. Question 25. Post-operative care. Assisting with deep breathing exercises. Patient who had abdominal surgery is instructed to use an incentive spirometer to prevent complications. How should the patient be instructed to use the device? A. Exhale forcefully into the device to remove secretions. B. Inhale deeply through the mouthpiece and hold the breath for a few seconds. C. Use the device once every 4 hours. D. Blow air quickly through the mouthpiece for maximum lung expansion. Answer: B. Inhale deeply through the mouthpiece and hold the breath for a few seconds. Explanation: an incentive spirometer encourages deep lung expansion to prevent pneumonia. Patients should inhale deeply and hold the breath to improve oxygenation. Question 26. Safe handling of oxygen equipment. A patient on oxygen therapy via nasal cannula requires transportation to radiology. What is the most important safety measure? A. Turn off the oxygen during transport to prevent fire hazards. B. Secure the oxygen tank upright on the transport cart. C. Instruct the patient to remove the nasal cannula briefly for the trip. D. Increase the oxygen flow to compensate for movement. Answer: B. Secure the oxygen tank upright on the transport cart. Explanation: oxygen tanks must be secured upright to prevent falls and leaks. Turning off oxygen can harm the patient and should not be done. Question 27. Catheter care. Preventing urinary tract infections (UTIs). Patient has an indwelling urinary catheter. What is the best practice to prevent infection? A. Keep the catheter bag elevated above bladder level. B. Empty the drainage bag before it is completely full. C. Change the catheter daily for cleanliness. D. Disconnect the catheter tubing frequently for flushing. Answer: B. Empty the drainage bag before it is completely full. Explanation: a full bag increases pressure and backflow risk, leading to UTIs. The drainage bag should always be kept lower than the bladder. Question 28. Recognizing and responding to seizures. A patient suddenly begins to have a generalized tonic-clonic seizure while in bed. What is the best immediate action for the patient care technician? A. Restrain the patient's arms and legs to prevent injury. B. Insert padded tongue blade to prevent the patient from biting their tongue. C. Turn the patient onto their side and protect their head. D. Attempt to hold the patient still and call for emergency assistance. Answer: C. Turn the patient onto their side and protect their head. Explanation: turning the patient to their side prevents airway obstruction from saliva or vomit. Protecting the head reduces injury risk. Never insert objects into the mouth. This can cause choking or dental injury. Do not restrain movement as it can cause fractures or muscle damage. Question 29. Post-mortem care. Handling deceased patient. Patient has just passed away and the family has requested to see the body before transport to the morgue. What is the best action by the patient care technician? A. Immediately remove all medical tubes and equipment before the family enters. B. Clean the patient's body, position them respectfully, and offer privacy to the family. C. Cover the patient's face with sheet before allowing family visitation. D. Inform the family that they must wait until funeral home staff arrives. Answer: B. Clean the patient's body, position them respectfully, and offer privacy to the family. Explanation: providing respectful postmortem care maintains the patient's dignity. Tubes may need to remain in place for autopsy cases. A removal should follow facility policy. Family should have the opportunity to say goodbye in peaceful setting. Question 30. Assisting with ambulation. Preventing falls. Patient with left-sided weakness after stroke needs assistance walking. How should the patient care technician position themselves when ambulating the patient? A. Stand on the patient's left, weaker side, slightly behind them. B. Stand on the patient's right, stronger side, holding their arm. C. Walk in front of the patient while offering verbal encouragement. D. Allow the patient to walk independently to promote strength. Answer A. Stand on the patient's left weaker side slightly behind them. Explanation. Supporting the weaker side prevents falls and improves balance. Standing slightly behind allows quick support if needed. Holding onto the strong side does not prevent falls effectively.